Well, welcome to the Medical Marijuana and Wellness webinar series. Tonight's topic is terpenes, the key to medical marijuana, a very important subject and one that is really the heart and soul of really medical cannabis, because this is where we get the medical properties from the cannabis plant. Tonight's sponsor is Surterra, and also they're known in Pennsylvania as they're known as Netta in Massachusetts and Good Blend in Pennsylvania and in Texas. And I have the pleasure of a couple of co-hosts that are going to really help us understand terpenes. One of the questions that a lot of people ask me is, I hear about terpenes, I go to a dispensary, how do I find out which terpenes are in the product? And more importantly, how do I know, get a certificate of analysis to know that they are in fact there? And what we're going to do is we have a schedule today where we're going to actually play a recorded video that Amy Green, a registered nurse from Medical Marijuana Treatment Clinics of Florida, has and I put together, which will explain terpenes. And then we're going to let Surterra actually tell us about terpenes, how a dispensary handles terpenes, and how you get certificates of analysis. So we hope to have a kind of a complete picture of the terpenes and how they work with the medical cannabis system. I would like to introduce my co-hosts. First of all, let me begin with someone who's helped me put this together and very important, Amy Green. Amy, tell us a little bit about yourself and who you are and what you do.
Sure. So again, my name's Amy Green. I'm a registered nurse. I'm working with Medical Marijuana Treatment Clinics of Florida at our Villages location. I primarily do new patient education. So a lot of what I do for patients is just walking them through the process of getting started and making sure that they're comfortable going and shopping for products and then using those products safely.
Sure. And you work for the Medical Marijuana Clinics of Florida. Is that correct? That's
correct.
Great. Yeah.
Yep.
And then we have a couple of representatives from Surterra Wellness. They're really the heart and soul of, let's just say, the technical part we're going to talk about of terpenes. Let me first introduce Forrest. Forrest, tell us a little bit about yourself and what you do.
Hi, good evening. Thanks for hosting us here. My name is Forrest Haag. I'm the product marketing manager for Surterra Wellness down in Florida. I live down here in Fort Lauderdale. My main role is involved with getting our messages out and helping convey our messages to consumers, and also helping make sure that we're telling the right story in our retail environments. Also, I'm involved in some of the different products that we have coming out, the new products that we have in the product development. And with me, I also have one of our store managers, Manny Alfinez. Manny, you want to introduce yourself?
Absolutely. Thank you for the slight introduction. My name is Manny Alfinez. I'm a 21-year Army retired veteran who's been in the cannabis industry for just going on 5 years now. And I am the store manager of the Pensacola dispensary in the Panhandle, Northwestern Panhandle.
So we've got a couple of people here between Manny and Amy and myself that have had some experience with terpenes, and hopefully we can answer your questions. By the way, we did receive a number of questions prior to this webinar, and we'll be answering them at the end of Surterra's presentation. And also, if you do have any questions during the presentation tonight, there's a little Q&A button like right here. Please click on that, and we'll be monitoring the questions and try to get them answered. So let's jump right into it. Let's talk terpenes. We have a terpene video, and I think it's something you might find interesting. Welcome to Medical Marijuana and Wellness. Today's topic is terpenes, the key to medical marijuana. Probably one of the most important compounds in cannabis to understand, especially from a medical marijuana standpoint. Today, I'm going to be joined by Amy Green, an RN at MMTC of Florida. And I do want to point out to everybody, this is a presentation for information purposes. Naturally, if you need any medical advice, please contact your physician or your medical marijuana doctor. Amy, let's talk terpenes. What are terpenes?
Sure. So terpenes are going to be the fat-loving compound that give cannabis its smell and its taste. So these are naturally occurring compounds that are also found in flowers, spices, fruits, vegetables, and essential oils. So this is what gives those products what they smell like and what they taste like.
Yeah, really interesting, because this is where the medical benefits from medical cannabis comes from. And it's actually something that the plant uses while it's growing to defend itself from fungus, insects, pests, and that type of thing.
Yeah, absolutely. This is the plant's natural defense mechanisms against all of those things.
Yeah, all the aroma and a lot of the taste comes from that you'll see here. When we talk about terpenes, there's terpenes and then there's terpenoids. One has undergone oxidation or been dried and one hasn't. What's interesting is that when you look at the world of cannabis, I tend to look at cannabis as a whole medicine cabinet that includes not only cannabinoids, but also the terpenes. And I think people don't pay enough attention to terpenes because those working together produce the entourage effect. And Amy, what's the entourage effect?
Sure. So the entourage effect is when you have the combination of cannabinoids, terpenes, and flavonoids, which are also smell and taste compounds found in cannabis. When all of these compounds are working together, you end up with really nice synergistic effects. And that's really what's going to give you the benefits from medical cannabis.
That's really the magic of medical cannabis. So when you're looking at cannabis itself, it's terpenes and cannabinoids and flavonoids all really working together. That's what it's made up of. And again, that creates that entourage effect that you were just talking about. And a couple of examples are when people are starting to learn how to dose, I recommend keeping some CBD oil around so that if you're starting to begin to feel the psychoactive effects of THC, you can take some CBD and it'll really calm you down or bring you back down.
Yeah, absolutely. THC and CBD really work very well together. And especially for new patients, I always recommend starting with a ratio product. It's going to be a little bit easier to deal with any side effects, such as that high feeling, just because it's not going to be as strong and it's going to be better well controlled by the CBD.
Sure. So terpenes are very, very important. There are cannabis-derived terpenes, of which we know there's over 200 of them. Really, only about 100 of them are being studied right now. But why don't you explain the pros and cons of the cannabis-derived terpenes?
Yeah, so there are two different ways that terpenes can be derived. One is going to be from the cannabis plant. The hard thing with this is it is a difficult process because the cannabis plant only naturally produces small amounts of these compounds. So it is difficult to extract the terpenes in large amounts. So when you have cannabis-derived terpenes, they are going to be in the ratio that plant produced it. But again, you are limited to whatever that plant is producing.
Sure. And that's why it makes it pretty, let's say, a lot costlier than really botanical derived terpenes, which can come from almost any plant that's out there.
Sure. So take, for example, lemons. Lemons contain a terpene called limonene. And from that, the limonene can be extracted and then sold as just concentrated limonene. It's a lot easier to produce or extract botanical terpenes than it is to extract terpenes from cannabis.
Sure. And it's interesting because high quality botanical derived terpenes or BDTs are really difficult to find. There's a lot of terpenes out there, but the high quality ones are there. And actually, the number of practitioners in the state of that know how to use it are very limited. I mean, in the state of Florida, I only know 4, and in the United States, I only know 6. So maybe I should just get out more. I don't know, but it's something that this is a little bit of magic, but something that's really, really important. I do want to point out, and they're not trying to have everybody read this whole table. This is an example of all the terpenes that are found in cannabis. And again, there's over 200 of them that have been identified. About 100 of them are being studied. And again, in nature, there's about 20,000 of them that have been studied. So let's dig down and talk terpenes. Talk to me about some of your favorites and why they work.
Yeah, absolutely. Definitely my favorite terpene is myrcene. That's just one that I really, really like. However, it's not always the most prevalent. Limonene and beta-caryophyllene are two of the most common terpenes. So a little bit about limonene. This is going to be a fruity or citrusy terpene. That's the aroma that you'll get from it. However, the effects are really great for lifting your mood, relieving stress and anxiety, anti-inflammatory. It's an antioxidant, and it's really great at relieving heartburn, gastric reflux, and it helps support digestion. So limonene is just a terpene, but it has a whole lot of benefits.
Right. And here's some of the cultivars or strains that you'll find that it's in. And we'll talk about temperatures later, but this is a good idea that, going back to myrcene, is probably one of the most commonly found terpenes in cannabis. Not only is it anti-inflammatory, but it's also a muscle relaxant and sedative, which really helps quite a bit with stress and anxiety.
Absolutely. It can be a really great choice to find a cultivar that you want to use in the evening time if you're looking for relaxation or to help you get to sleep. Something that has a high percentage of myrcene can definitely give you those benefits that you're looking for.
Sure.
Sorry, go ahead.
Go ahead.
Sure. So another one that I really love is pinene, and that's going to be that rich pine smell, like you're walking through a pine forest. Really great for pain, really great for stress and anxiety, anti-inflammatory, and it can also improve or help improve short-term memory. But really, it's that strong smell that you get from rosemary, basil, pine trees.
Sure. And when you talk about improved short-term memory, it does do that. If PTS is one of the issues that you're looking for, you may want to go easy on or just try to avoid pinene just to be safe. Also, when you talk about bronchial inhaler, I think it's important to point out cannabis works very much like bronchial inhalers that we have in pharma drugs. It's something that has been designed and can be used with your lungs, very different than smoking as we know it. Is that correct?
That's correct. Yeah, cannabis has been shown to be an effective bronchodilator, and part of that is the terpenes that are in that specific strain that a person is using. For example, alpha-pinene has been shown to be an effective bronchodilator and help open up the airways.
Right. And linalool is one of the big favorites.
Yeah, so linalool is what you think of when you smell lavender. It has a strong lavender smell. It's really great for elevating your mood, stress, anxiety, really great for insomnia and improving the quality of your sleep. It also has sedative effects, and it can be used for pain, antifungal, or antimicrobial uses.
So that, like an antifungal and antimicrobial. Humulene is one that's not known very popular from the standpoint of the press, but it really has some not only earthy tones, but it helps with a lot of different conditions.
Absolutely. So humulene is that smell that we associate with hops and tobacco, ginseng, cilantro. It's that deep, earthy smell, really great for inflammation, antibacterial, antifungal. And it's also been shown to help suppress appetite. So if somebody is worried about getting the quote unquote munchies when they're using cannabis product, if you're looking for strains or cultivars that are higher in humulene, it can help suppress that stimulated appetite.
Sure. Now, there's a couple others that you mentioned, beta-caryophyllene earlier. Why don't we start there? Because that's one of your favorites as well.
Yeah, it really is. So this is going to be that spicy, earthy, woody smell that you'll get with black pepper, cinnamon, oregano, and cloves. And that specific terpene is great for its anti-inflammatory and pain relieving effects. It's also a powerful antidepressant, great for alcohol cravings, relieving stress and anxiety, and it may also augment some types of chemotherapy. So this is a very powerful terpene.
Yeah, now that's kind of important for a lot of people, fortunate or unfortunately. Terpinolene is interesting. Why don't you start with that one?
Sure. So terpinolene is going to have a floral, fresh, woody smell similar to lilacs, apples, nutmeg, or cumin. It's really great for elevating the mood. Its antibacterial, antifungal, antimicrobial properties also has been shown to have antioxidant activity, and it may help reduce the proliferation of cancer cells in the body.
Yeah, that's really interesting. Citronella. So why don't you start there?
Sir, so citronellol is going to have a bright, fresh scent to it. It's what you might associate with citronella, basil, catnip, eucalyptus, ginger, has almost that sharp smell. So it can possibly be a neuroprotectant. It does have anticonvulsant properties. It has been shown to have bronchodilator properties. It has antiseptic, antifungal properties, and it's a great anti-inflammatory, and it may help with hypertension or high blood pressure.
Yeah, that's great. And Phytol is really interesting as well.
Sure. So that's going to have a floral, balsamic, grassy smell. It's what you would smell if you can think of green tea, that smell. So very earthy, but very subtle. It's great for relieving stress and anxiety, anti-inflammatory, pain relief. It is an antioxidant. It does have sedative properties, so it can help with relaxation or with getting asleep and staying asleep. And then it can also help with convulsions. So if somebody has a seizure disorder or an epilepsy disorder, it can help with controlling seizures.
Yeah. One of my favorites is eucalyptol.
Yeah, absolutely. This is that mint smell. So this is what you'll find in eucalyptus, cardamom, tea tree oil, and sage. So it has a very pungent smell to it. Great antifungal properties. It has been shown to have pain relieving properties. It may help reduce blood pressure. It is a great anti-inflammatory. It may also help with sinus infections, and it may also help improve cognitive function for those with dementia.
Now, that's very interesting itself. One of the questions is, how do you find what terpenes are inside the product you're looking at? And this is where the certificate of analysis comes into play.
Yeah, absolutely. So specifically in the state of Florida, any product sold in a dispensary must be accompanied by a certificate of analysis. So anytime you're purchasing a product, whether that is a gummy or it's a concentrate or flour, they have to be able to produce a certificate analysis for you. And that's going to give you a lot of important information, not only the total amount of cannabinoids in that product, but specifically the breakdown of terpenes in that product. So on this example, we can see that there's a lot of limonene, and then farnesene is going to be the second largest terpene, followed by linalool, carotene, alpha humulene, sabanine. And all of these terpenes combined together are what's giving that specific cultivar or strain of cannabis its properties. So this is what's going to give you those pain relieving properties, the anti-inflammatory, the antioxidant effects. It's going to be down to what terpenes are in that specific product.
And as you mentioned, any product that you buy from a dispensary here in Florida, you can ask for the certificate of analysis and they'll be able to produce that for you. In fact, I think they're putting QR codes on most of the products so you can actually look it up with your cell phone.
Yeah, I have seen that, and it's way easier for patients to then find the information that they're looking for and find that particular product that's going to work very well for them.
Mm-hmm. And then this goes back to the different routes of administration. And I know we just finished a webinar on this, and I'm going to refer people back to that webinar to go through each of these different routes of administration. But again, when you're looking at these particular products, go back and get the COAs so you know exactly what terpenes are going to fit into this profile. But I do want to highlight a couple, at least a couple of them down here: the inhalation, the flower, and the concentrates. When you're looking for how do I get the best terpenes out of that, that relates to the temperature that you're using.
Yeah, absolutely. So when you're using something like flower, you're using the flower of the plant, the temperature that you apply to that product is going to change how much THC is released, how much terpenes are released, and how much of those substances are burned off in the process. So when you apply low heat, you're going to get more terpenes. It's going to have a lot stronger smell and taste, but you might be getting a slightly lower level of THC in that dose. Mm-hmm. Versus a high dose, you're going to get a higher THC dose, but you might have slightly less terpenes because they tend to burn off at a lower temperature.
Yeah, and this not only applies to flower, but when you're using a flower vaporizer, but it also applies if you're using concentrates. Because one of the reasons why you go to a concentrate, a rosin, a resin, hash, something like that, is to be able to take advantage of the terpenes. And again, you have on your terpene pen, you have usually at least 3 settings and sometimes 4, the low, medium, and high. And this corresponds to those 3 settings.
Yeah, and you're totally right. It is not just flour. You will find this is very helpful when you're using a vape pen, when you're using a dab pen or a dab rig. The temperature that you choose to use your product at, it does make a difference for how that product is going to work for you.
Sure. Well, listen, any final comments, Amy?
No, I think we've covered it, but if you do have any more questions, feel free to drop them in the question and answer section or stop by Marijuana Aware and check out some of the previous webinars that we've done on these topics.
Yeah, you can also send us an email to events@marijuanaaware.com. And more importantly, follow us on social media. We have not only this webinar or this particular video, but other videos that, like, for example, routes of administration and the basics of medical marijuana. So one of the questions that comes up is, how does the dispensary let you know what terpenes are in their products? And more importantly, which products are good for different conditions? Forrest and Manny, do you want to tell us a little bit about that?
Sure. So thank you for having us. I'm happy to be here and to be able to assist everybody who's participating and or will participate. And what we're looking at right now is our wellness line. And as you could probably see, we have the ratio-based products here from Serene down to Dream, high CBD to high THC products. And on those graphics, you'll see that we have a small portion of our terpene chart there to show you the most abundant terpene to the least terpene. And typically the top 3 would kind of give us a definition of what that effect is going to be for that patient and or customer and how to direct it. And then you'll also see that there's some different products in those graphics, such as a distillate pen, which is a concentrate. We have our tinctures, which are easier to dose because we always recommend going low and slow. We have chews and we have vapes. And one thing I like to point out is that, as you can also see, some of the higher CBD products like the 5-to-1 Serene do not have a vape in it. And to clarify why, CBD in its natural form is going to be crystallized for the most part, and it's very hard to keep in that fluid form to make it into a vape. So most CBD products, anything more than a 1-to-1 is probably going to be an edible or oral or sublingual route of administration.
It's kind of interesting to me that some of the differences, in some of the products really relate to the terpene profile. Is that correct?
It is. A lot of people like to shop by the THC percentage, and I like to argue that point by saying, well, if you were just going for THC, that would be an isolated product, which most pharmacopoeia would have. And one of the metaphors I toss in there is, imagine if you're going to an Italian restaurant and you order spaghetti and meatballs. You went with your spouse, significant other, children, and you all order spaghetti and meatballs. The chef is going to serve you spaghetti, same spaghetti from the same pot, your THC, if you will, same meatballs from the same pot, your CBD, if you will. And at first glance, it's going to look the same, taste the same, and have the same effects. Now, what makes a spaghetti and meatball dish great is the sauce. Some people like white sauce, the vodka sauce. Some people like the marinara sauce. Then you're going to add garlic, Parmesan. Now you just change the appearance, the aroma, and the flavor of that spaghetti and meatball dish. And that's what terpenes are to cannabis. It actually dictates the effect of what you're looking for or may not be looking for. And because Surterra has the wellness line that stays consistent, we're able to delineate which is which and help you shop for better products. That way you're keeping your body guessing.
Sure. And it's very, very important. Now you so if I walk into Surterra Wellness and I want to find out about terpenes, what terpenes are in the products, what do I do?
It's very simple. We actually have cards that are up, display cards that show all of our products, or for the most part, all of our products. And it'll list, for the most part, the top 3 terpenes. Otherwise, you can always talk to one of our guides and we'll be happy to bring up the certificate of analysis as you described earlier. And we can show you that certificate of analysis or just speak it out to you, whichever you prefer. So that way you can see exactly what you're getting in that product to include the terpene profile.
Sure. Now, I think that also, I think that in the future, I know you're working very hard. Your web guys are working very hard to put that online. Is that correct?
It is. But even if it's online, I always try to encourage customers to come in and ask prior to purchasing. It's one thing to have the note ahead of time and make an informed decision rather than getting the product, finding out you don't like it, and then trying to figure out why. But either way, we'll be able to help you.
Yeah, it's kind of very, very interesting. And you pay, I mean, one of the reasons I like working with and using Surterra's products is you do a great job of keeping the terpenes, especially in the especially in here, what you see, the sublinguals, because that's really, really critical. That's how a lot of people start.
Yes, it's an easier way to dose. The sublinguals actually have an onset of about 15 to 45 minutes, depending on diet. And you don't lose the terpenes when you use sublinguals. As most may know, terpenes are the most volatile of the cannabis product. And for most part, if you swallow too fast, your stomach acids could destroy that terpene profile, therefore not having the effect you might be looking for. So
Sure.
that's why sublinguals are under the tongue. You get that sublingual absorption bioavailability, and you get that onset a little bit more rapid than actually ingesting it.
Yeah, and I know that, and I'm going to say make something very clear. Many dispensaries, especially in their sublingual products, use isolates, and there are no terpenes in there. And I think that's one of the things that I want to point out is that quality dispensaries will have the terpenes in their sublinguals.
At the very least, I agree with that.
Yeah, and I know that I've worked with a lot of questions. So I work with a number of patients that really, when they're looking for relief, we're able to match the terpene profile. And that's really the important part of using medical cannabis. It's really the terpenes, not necessarily the strains that bring you the relief that you're looking for. Why don't we do this? We had some questions that were submitted prior to the webinar. Why don't we bring up the first set of questions and kind of start answering some of the questions to get those out that's out there. One question is, can one terpene counteract the effects of another? For instance, does caryophyllene counteract the effects of limonene? Amy, what do you think of that?
Sure. So not exactly. They're not going to counteract each other per se. You may have a more dominant terpene, say it's in a higher percentage in that particular cultivar, and you'll find those are going to be the stronger effects just because it's in a larger quantity. If you were to find a cultivar that had equal amounts, then you would have kind of effects from both of those terpenes, but they're going to kind of work together to give you effects. They're not really going to compete against each other.
Right. Now, one of the really good questions is that came in is about a condition called interstitial cytosis. I'm going to not going to pronounce that correctly, which has to do with something that your bladder and your internal organs really bloat because of the spices and fruity things. Can you use terpenes? Well, terpenes aren't bringing you all of the fruit, let's just say, components, but terpenes are a specific component that works with the receptors in your body to be able to address certain conditions. I can't answer that. I can't answer that directly as a yes or a no. And let me explain to you why. Every person's body is different. When it comes to using medical cannabis, candidly, when it comes to using coffee or alcohol, everybody has a different tolerance to that. And it really depends on how your body reacts to that. What I would suggest that you do is take a cannabis product, take a sublingual, use a very small amount, 0.25% on the eyedropper, take a 1-to-1 and try that and see if you have any reaction to it. Because what we really want to do is we really want to find out how sensitive your body is to those terpenes. And if you take a look at the limonene, the myrcenes, and that type of thing, they do have fruity components to them. But I have a feeling that they may work because, again, there's not the complete fruity plant. It's just a terpene profile, the part that's looking at working with your receptors. So I would say go low and go slow and to try it. And it should be able to work. But again, let's address it specifically for your particular body. What is in a hybrid strain? What are the trace terpenes to avoid if prone to anxiety? Manny, do you want to try that one?
Sure, absolutely. So hybrid strains are typically not going to have as much of certain terpenes that would actually induce anxiety. I would even take it as far to say sativa strains, which most people who deal with anxiety tend to stay away from. But as Amy was saying, there's two terpenes in particular that don't counteract, but mixed together kind of tend to induce anxiety. And that's limonene and alpha pinene together, particularly if they're the top two. So if in a hybrid strain or a sativa strain, I would recommend avoiding alpha limonene or alpha pinene mixed together, particularly the top two terpenes.
Right. And I always caution people about pinene because, again, it improves short-term memory. But if you're one of the conditions you're trying to address is PTS, you may want to be careful with that particular one as well. So that's something to really take a look at. What are the benefits of cooking with terpenes? Amy, do you want to try that one?
Yeah, sure, I can try this one. So the benefits are here's the hard thing. So it depends on how you're cooking with them. Just like Manny said, like if you are ingesting them and you're swallowing them, your stomach acids are going to break down some of those terpenes. Same thing if you are cooking at high heat, some of those terpenes are going to burn off. But definitely there are benefits to cooking with terpenes. You can still get the benefits. They just might not be as strong as if it were inhaled or used sublingually.
Well, I think also we talked earlier about making sure the temperature is not something that will cook off the terpenes. I think that's what's important. The key is to be able to get the benefits of the terpenes without cooking them off, but also candidly in a form that you really enjoy consuming, which is something that's there. Let's talk about one other. What is farnesene and why do we seeing it more and more in cannabis here in Florida? Well, farnesene is it's not one of the predominant cannabinoids that you find. You can find it in products. It is something that's there. I have not seen it being more and more in more and more of the cannabis plants here in Florida. One dispensary does in fact have a products that they're growing that they feature this, but it's not necessarily a predominant. Let's just say it's not a predominant terpene. Now, what is it good for? It's good for soothing your mood. It's calming and sedative. It's something that is typically found in green apple skins that's out there. So I think the reason you're seeing more and more of it is because some dispensaries are promoting it. I would say that it's part of a profile, but it's not what I call a predominant terpene that's really out there. It says, what is the minimum amount that I need to look at in order to feel the most effects? Is it a combination of many terpenes or just one? I'm going to take part of this, and Amy, if you could help me with the rest of it, that would be great. Terpenes, you don't need a lot of terpenes in the product to be able to get the effect. In fact, if anything, terpenes relate very closely to the go low and go slow effect of trying the product, find out where you get your best therapeutic relief and being able to stay at that particular level. Now, terpenes do work together and they will complement each other. And that's something that's really something to look at. But there's really not, like, for example, when you're looking at using sublinguals, you'll want to take a certain amount, like 0.25 milliliters or 0.5. You really don't have to worry about that. If terpenes are in the product, really what you have to worry about is the product working for you. Amy, do you have some comments on that?
No, I think you've covered it pretty well. It's always going to be dose related. And then just finding those terpenes that do the most benefit for you, that's part of the journey.
Right. That's really something that's really there. What is the most effective way to consume terpenes considering their heat sensitivity? That is an excellent question. And that goes back to looking at the heat profile that you're looking at. One of the things that I always get a kick out of is people will tell me, well, I don't need medical cannabis. What I'm going to do is I'm just going to smoke a joint. It'll take care of it. And what's interesting is the minute you take that, your flame, put it up to that blunt or that joint, that 500-degree temperature burns off half of the cannabinoids, all the terpenes and all the flavonoids. So you're getting a significantly reduced amount of medical efficacy from that. That's the bad news. The good news is it still works, okay? It still gives some medical benefits that are out there, not as many as it could. But I think the answer to your question is really look at the temperature settings that are there. I know that, for example, when I'm making brownies, for example, and I know that Betty Crocker recommended heat range is one thing, but I tend to look at the terpenes that I'm looking at addressing, and I'm then being able to cook the product at that particular temperature to be able to get the best amount of terpenes out of the products that we're using. Amy, you have any comments on that?
Yep, I'm a huge fan of finding a vape battery that has adjustable temperatures for this exact reason. It's finding that temperature that really works well for you and that you're getting the most benefits from.
Yeah, I think that's really, really important. That's why a lot of the vape pens that you see have temperature settings, low, medium, and high, because it allows you to really focus in on the terpenes that you want to use. If you buy a pen, normally the pens are set, if it doesn't have a temperature setting, they're normally set to about 390 degrees. Manny, do you want to, what does Surterra set their vape pens at?
So I don't actually have the specific temperatures besides low, medium, and high, but most batteries are going to be set to what the boiling point of the highest terpene is going to be, which is, or excuse me, the cannabinoid, which is THCV, just around, I believe, 400 degrees.
Right. It's really up there. So that's one thing to pay attention to. So yeah, I think that's where you need to take a look at the different temperature settings that are there. Do full spectrum products contain terpenes? The answer is absolutely. Manny, what's your thoughts on that?
Oh, 100%. Unless it's an isolate, it's going to have terpenes for the most part, or unless the formulation is calling for not having a terpene specific profile. But full spectrum products do contain the terpenes, and they're more likely going to be cannabis derived terpenes specific to that strain that is being developed in a vape or a concentrate or otherwise.
Okay, that's great. Let's take a look at where do you find the right terpenes for your body? I think that really has to do with, I think that what are you trying to address? What condition are you trying to address? And then being able to match that to the terpenes. Again, Manny, do you want to take that one? And maybe Amy,
Sure.
you can comment as well.
Because most of the time when I do the consultations, I typically address the top 3 terpenes that are dominantly found in the products on the market today, which is going to be myrcene, limonene, and B-caryophyllene. And typically, myrcene is going to be more for the indica type effect, B-caryophyllene for quite in the middle hybrids or analgesic and pain relief. And then limonene is mostly going to be your sativa cultivar or uplifting type of product. If you're dealing with flower, I always recommend using your olfactory system, your own schnoz, and give it a sniff if you can, and trust your nose. Your body may reject it and kind of be like, oh, that's not for me. Or even if it's skunky, it may say, oh, I like that smell. And typically your olfactory system is going to give you a good judgment of what or how that product's going to affect you.
Sure. And by the way, while we're on this slide, I want to go back to the question about the fruity question. If you look at the number of the terpenes that are here, you'll see that there are terpenes, for example, like humulene. You'll see there are terpenes like caryophyllene that really are not, they're spicy, but they're not necessarily fruity. And I think that's something to really take a look at when you're looking at which product that you really want to take a look at. Terpenylene is one that could help you quite a bit as well, depending on the condition that you want to address. Key, match the terpene to the condition that you're trying to address, and then ask the attendant when you go to Surterra, ask the person behind the counter what product has this particular terpene in it, and they'll be able to help you quite a bit. If terpenes are so important, how does that affect the efficacy of the cartridges flavored with botanically derived terpenes? Amy, do you want to try that one, or do you want me to take that one on?
I'm going to let you take that one just because, yeah, I'm just going to let you take that one.
Okay. First of all, a lot of the botanically derived terpenes are good for you. There's no question that the terpenes are good for you, whether they come in cannabis or they come in some flower that's on the outside. A lot of the botanically derived terpenes put out by a number of vendors, Troop Terpene and people like that, they're very good products to use. The key, though, is there's really only about 3 or 4 terpene vendors that really that go through the rigorous testing that we are used to in the cannabis industry. And that's one of the things to be careful of. I am not a huge fan of cartridges that are flavored, especially with botanical terpenes. And that's because the question is the COAs, and more importantly, not just certificate of authenticity or the quality of the question boils down to what's the quality of the testing. And I have not found the testing to be to the level that makes me feel comfortable as a cannabis practitioner. So yeah, cannabis terpenes are important, but I am somebody that wants to really make sure that if you're going to use a botanically derived terpene, that it has been effectively tested. And I think that's really, really important to go back to. One of the questions that Donna asks is, what's the difference between sativa, hybrid, indica, and do you know what terpenes are in these strains? Manny, I think that's right up your alley, isn't it?
It sure is. So as we mentioned before, sativa, hybrid, and indica are your three categories or cultivars of cannabis. But that's like saying white wine, red wine, and rosé. You still have a plethora of different options in there, whether it's sweet, bubbly, or otherwise. So typically, sativa is going to be a more narrow leaf type of flower product derived from flower that's going to have an uplifting effect. Hybrids are going to be somewhere around the middle, which you can get hybrids slightly sativa leaning or slightly indica leaning. And then indicas, the famous metaphor is in the couch. Those are going to be more sedative, if not relaxing, and a more body effect. Well, another analogy or metaphor I throw in there is that sativas in high THC are to get you high, more elevated and uplifted, where indicas are going to be more along the lines of getting you stoned, to where you don't move, again, in the couch effect. And to find out what terpenes are in those different categories, sativa, again, is going to be typically limonene or an uplifting terpene like alpha-pinene, eucalyptol, followed by some of the other dominant terpenes like caryophyllene and myrcene. Hybrid is typically more dominant in caryophyllene, and indicas are typically more dominant in myrcene, which is also known to be to allow the THC to get through the blood-brain barrier a little bit easier. So hence, indicas don't necessarily need those higher THC percentages, particularly if they're above 2% in terpene percentages.
Sure, there you go. Angela asked a couple of really good questions. One of them is, the QR code doesn't give any information, at least that's my experience. I think that really depends on the dispensary you're working with and the QR codes that they put out there. I know, Surterra, you do a great job of listing all the terpenes on your QR codes.
The QR codes we have in our products right now do not bring up the certificate of analysis just yet.
Okay.
However, again, when customers come into shop, we always ask if they're interested in the terpene profiles, and depending on the level of interest, we suggest the COAs there before they purchase the product rather than after.
Sure. Okay. One of the really good questions is what products to assist in keeping blood sugar down for diabetes? That is actually a very, very good question. I know that that's something that's brought up quite a bit. There's a couple of different options that you have when you take a look at take a look at that. One of them is that if you take a look at myrcene, you take a look at beta caryophyllene, both of those will really help you with your diabetes. I know that eucalyptol is known to help with blood pressure, and also humulene is really known to help in those particular categories. So if you're looking at addressing diabetes, those are a couple of different options that you might want to take a look at. And by the way, there's a lot of research being done right now on diabetes and terpenes. It really wasn't researched that much in the past, but I know that it's something that's really coming about right now that's really there. And I hope that answers your question. One of the questions that Angela asked is, what is the healthiest way to consume medication? That I think depends on really it really depends on you. I think some people prefer the oral approaches, oral meaning sublinguals, for example, and a lot of people want to stay away from putting anything into their lungs, much like because they're worried about how it affects their lungs. Although cannabis, really, like a lot of pharma products, can really help you with a number of the conditions with your lungs. Manny, do you want to kind of take that one on, because you have a number of products and you see a number of different customers? I think it really depends on the customer's preference. Is that safe to say?
Absolutely. One of the first questions we ask after we get their general information and verify them is what is their preferred route of administration, whether it's inhalation, which is vaping, smoking, which is the flower, sublingual, oral, topical. And depending on how that works is where we direct them. So it's all personal preference.
Right. And I think that the terpenes will come with almost all, in fact, they come with each of the different products. It really depends on what's really the best for you. I know that, again, some people really shy away from inhalation. Some people prefer it as a method of a preferred method. Again, I can't tell you what you like, but I can tell you that when you do try it, use a product, take a route of administration that you will use. Don't use something that's foreign to you or something that you really don't like to use. So let's jump on to the next question, Lee. Okay. Explain RSO, please. That's an excellent question. RSO stands for Rick Simpson oil. There's a whole story behind Rick Simpson. Manny, do you want to take that one?
Sure. So RSO in with Surterra, it's described as FSO, full spectrum oil. It is basically the plant in oil form. It's not to be inhaled. It's meant to be taken orally, sublingually, or topically. And it's can be very potent. Again, just because you have the whole plant in the oil, the extraction process is significant enough to maintain the integrity of the flower. Doesn't necessarily mean it's gonna be more potent. It just has more components in it that has more areas to help you, or more ways to help you in areas of relief or better quality of life.
Great. Great. Yeah, I think I'm a huge fan of RSO. It's whole plant. And I think that Rick Simpson did a great job of really contributing that particular product to the world. And it works very effectively. I know that there are certain cases, I have herniated discs in my neck that can, in fact, 7 of them, which can, in fact, lead to a lot of pain. And RSO works great for that. Now, one thing I do want to caution, Leah, is RSO, I consider RSO to be what I call the Bacardi 151 of the cannabis world. It is very strong. So when you use it, go low and go slow, because it can have some, let's just say, some strong effects. Manny, your thoughts on that?
No, I agree. Again, it depends on the batch. It depends on the strain. It depends on if it's a ratio-based RSO or FSO, again. But typically, yeah, it's going to have more of a potent effect because, again, it has more cannabinoids, more terpenes. It has more of the products from the flower itself, its whole plant extraction, than just having a distillate.
Right, right. Angela also asked the question, how come the same strain can have different effects in flower as opposed to vape resin? They all affect me differently, even when they have the same terpenes and strains. Manny, you want to take that one, or you want me to take it?
I'll jump on that a little bit. So on flower, depending on where you get it from, the flower can vary from batch to batch, whether it's terpene percentage, even though it has the same terpenes, or THC percentage. And those two kind of go hand in hand. And if you're vaping, using rosin, live rosin, or resin and dabbing, that can also play an effect on your tolerance level, where you switch from flower to the vapes. So in general, you want to kind of stay between 2 to 3 different products. As one product starts to wear off, jump to the other one that's similar, keep the body guessing, and then seesaw back and forth.
Right, because you really want your body to be able to work with the cannabinoids that are coming into your body. Also taking a break now and then, taking what you call a holiday. I know every 4 to 6 weeks, I'll take a day or 2 off just to let my body kind of reset. And really, it makes the use of cannabis more effective for me. Now, some people will tell you you should take 3 to 4 days off. In my particular case, I have herniated discs in my neck. I can go about a day, maybe a day and a half, and then my neck taps my shoulder and says, you better do something pretty quickly or you're going to know I'm here. So it really depends on the person. But I think having them come out, taking a holiday, I think would help a little bit as well. Your thoughts on that, Manny?
Yeah, I completely agree. It's easier said than done. And if you can actually implement some CBD in there, it might help with the tolerance break. And then the last point on that flower, another little metaphor is, imagine you're going grocery shopping and you buy some fruit that's beautiful, sweet, tastes great. It's everything. You go next week, same grocery outlet, same product, and it's not as flavorful or sweet. It's a grown flower, even though it's in a controlled environment, there are going to be some variations.
Sure. Let's jump over some of the some of the questions that were asked prior to the webinar. Lee, can we put up a few of those? I think that's important to address them as well. It said, I am 65 and living my best life because of cannabis. I need to reduce the arthritic pain and discomfort. Any words of wisdom? Manny, you want to try that one?
Sure. I'm happy to hear that somebody's doing well, especially at 65 with cannabis. That's great. And depending on where the arthritis pain, if it's all over pain, I recommend a tincture or a Theragel. Soothe 1-to-1 with CBD, caryophyllene would be most beneficial. And then we also have a topical called the Fix. It's a 1-to-1 ratio with a lot of caryophyllene in it. Again, one of my favorite terpenes. That's a great analgesic. Also works best with our CB1 and CB2 receptors directly. And you could use that topically. And it's a salve rather than a lotion. And just to keep in mind, lotions are more going to be for muscle aches, whereas salves are going to be more for that joint pain. And you would want to use it on the top of the hands if the arthritis is in the hands, directly on the joint where it's most bony, so it gets deep into that joint, and that works well. And you could use both at the same time. The balm will not have any euphoric effects or psychoactive effects, whereas the 1-to-1 tincture will be manageable during the day and or in the evening and help reduce the inflammation, the pain, and also probably some of the stress and anxiety you're dealing with some of that pain.
Yeah, I think one of the things to pay attention to is what I call your coverage or your regime. I know, for example, in my case, the herniated discs are not going to go away. So I have to pay attention to having something I do in the morning, something I do in midday, something I do in the evening. And I've also found that a little bit of chocolate, because I'm a chocoholic, before I go to bed helps me stay asleep all night, rather than using a tincture or something where I wake up at 2 or 3 in the morning. So it really, look at something where it's almost like microdosing. You want to try a little bit as you go through the day to really address your particular condition, because, for example, sublinguals will wear off within 4 to 6 hours, and you don't want to leave yourself at a point where, if you have a condition like arthritis that's going to be there, you need to address it all day long. It's there.
Yeah.
Yeah. Oh, so one of the other questions is, I heard that THC is part of the effects of cannabis, but the terpenes are actually would give you that strain-specific high. Amy, that's kind of an interesting question. You want to try that one?
Yeah, absolutely. So the interesting thing about the cannabis plant is that it's made up of all these different parts. So THC is that part that's going to give you that euphoric high. It's going to have the psychoactive effects, where the terpenes are really going to drive where that's going. So the terpenes are going to help with that anti-inflammatory effects, the pain relieving effects, the anti-nausea effects. It's really going to be the terpenes that are guiding the THC to those specific areas.
Right. That's really there. I think it's really, really important to pay attention to. What products do you recommend for Crohn's disease? Crohn's disease is really tough, and it's something that we really have to pay attention to. Best terpenes to pay attention to are limonene, myrcene, pinene, beta-caryophyllene, and terpinolene. Now, we're going through those very quickly. I'll make sure that in a follow-up email that's kind of laid out as to which of those terpenes work best for you. But I would pay attention to products that have those particular terpene profiles, because they'll help you with your particular conditions there. Does the balm have terpenes in it? Is the product that helps me most with pain topically? What is most recommended for pain relief? Manny, I think that's right up your alley.
Yeah, I was just mentioning earlier, the balm does have terpenes in it. One of the primary terpenes is caryophyllene, which is the great analgesic. I'll go back to that one all the time. It is a 1-to-1. Even if it wasn't, it won't break the blood-brain barrier, won't get into your bloodstream, and it is great for joint pain as well as muscle relief. We've even had some clients come back talking about how it works great for migraines. They rub just a little bit on their side of the temples, and their migraine goes away within minutes, and it's gone until the next migraine onsets.
Right.
So yeah, definitely the balm is the balm.
Mm-hmm. Well, you guys have a very good topical product.
Yes, it's one of the better ones, if I say so myself.
Right. It's really out there. So one of the other questions that came in here is, any suggestions on which terpenes to stay away from where migraines are concerned? I think that, Amy, do you want to try this one or you want me to take it?
I can take a stab at it, sure. So the biggest thing is you're going to want to pay attention to any terpenes that you may be sensitive to that may exacerbate your migraine. So whereas you might find certain terpenes like limonene, myrcene, linalool great for you, you might find that if you use, say, norindadol a lot, if that's a major terpene and you're sensitive to it, that may exacerbate your migraine. So it's really going to be individualized to you as far as what terpenes might exacerbate that. And that's going to be just completely based on what works and what doesn't work for you specifically.
Sure. What I do want to do is I want to go back to the diabetes question for a second, because I'm not sure I was clear enough. One of the terpenes to pay attention to and to work with when you have diabetes is beta-caryophyllene. It's very, very good for diabetics. That can help with that. I wasn't clear enough, I don't think, in my answer in reviewing that. So hopefully that'll help a little bit. What's the difference between a terpene pen and a regular pen? Manny, I think this falls right in your category.
Okay. So as far as the terpene pen, I'm not very familiar depending on where you're shopping at. However, what I will say is one of our most terpene rich products is going to be our live rosin vapes. Typically, anytime you hear something with live in front of it means that it goes through a solventless process, which is the most pure, not necessarily the most potent. But again, we discussed that with the FSO, whereas if you have more components of the plant there, you have more of the synergistic or entourage effect. As far as popcorn lung with vapes, is that a concern? I would suggest never, ever buying black market over the counter. As we discussed earlier, certificates of analysis come with every product in the state of Florida as mandated and can be provided upon request, which means there's liability. You'll check for mycotoxins, heavy metals, pesticides, not just your terpene levels. That way you can see the product is safe. So again, as far as a terpene pen, if you're talking about a dispensary, I would suggest the live rosin vape pens, which are going to be more flavorful, more of a holistic experience. And as far as popcorn lung, as long as you're buying it from dispensary, there's liability, suggesting that it's 100% safe.
Sure. One of the questions comes up is what helps for tremors for Parkinson's? Manny, you want to try that one?
So tremors and Parkinson's, we always recommend linalool or myrcene, which is going to be more of a sedative effect, along with a high CBD product. One of the troubles when you're dealing with CBD, however, is that most people don't necessarily give it enough time to really build up in their system, which is why the once one works. You get a little bit of that THC with the 50% CBD, and then linalool or myrcene helps tremendously with that. And one of the products we suggest for that in the store where I'm at in Pensacola or dispensary is Soothe 1-to-1, either in a tincture or a Theragel.
I think it's important to point out Parkinson's is one of those conditions that you're not, some conditions you can take medical cannabis and in a day or two you start seeing some relief. Parkinson's really takes, I've heard it takes sometimes 2 to 3 months to really see the relief from it. Your thoughts on it, Manny?
No, I agree. Again, that CBD really helps. You'll find a little bit of relief almost immediately because of the terpenes, along with the CBD and THC. However, the full benefits of it can take anywhere from weeks to, as you suggested, months.
Right. I started working with a couple of Parkinson's patients a couple of years ago, and one patient saw relief. You're right, a little bit of relief right away, but really after 3 months, and I know that's a long time, they really saw a tremendous amount of relief and really helped them manage the condition. It's one of those conditions that's tough. It's done a lot of damage to your body, and it just takes a while for your body to be able to recover and take advantage of things like cannabis to really try to return to a normal state. You'll never get back to a 100% normal state, but it can help you get a lot of your life back, and that's really what's important, that's there.
I agree.
Let's see. Linda has a great question. She's been trying it for years. She's trying to find a product for her situation. Manny, I think if people come in to Surterra and say, I have this condition, you can actually help them find a product, can't you?
Oh, absolutely. One of the things we pride ourselves on is doing full consultations. So pre-COVID, that's what was always happening. And then post-COVID, it kind of faded away as everybody was afraid to get close. But now that's coming back, and any person that comes into the dispensary who needs to sit down, we'll make it as comfortable as possible, or we have our own consult room if they're dealing with anxiety or social anxiety, along with pain or otherwise. And we'll take the time to do a consultation, figure out what works. And it's not just the manner of the diagnosis, but we also take into account what they want out of life, if they have a job, if they're looking to go back to work. So that way we can provide certain products, as you mentioned, for the morning, day, and night, if not one for all, depending on the needs of the patient.
Now, I think, Amy, you had a really good comment about this. You want to give us your comment about journaling?
Yeah, absolutely. I think one of the most important parts of being especially a newer patient, as you're trying to figure out what does or does not work for you, is keeping a treatment journal. That's going to include how you're feeling beforehand, what product you took, how it made you feel when you were using it, and then ultimately, did that product help with what you were trying to treat? And then just having that ability to look back and see what did and did not work for you, and be a little bit more objective about how you're using your products and how you're viewing your products.
Yeah, I think that's really important. Pay attention to what you're doing. Keep a journal. Find out how much you're taking, what reaction it has. I know it. When I first heard about this and I got into cannabis, I thought, what do I really need to do that for? And then as I went back and looked at my journal, it became blatantly clear what I should be doing. So it's something to really pay attention to that's there. Leah asked the question, am I able to print the pages for future use? I'm trying to take notes. I'm trying to figure out which pages you're looking at. Leah, I will say you will get a copy of the presentation in a flipbook format. So you can actually print that if that really helps. Hopefully that'll help you be able to let's just say, remember a lot of the things and put your notes with those, and it'll help quite a bit. Terps to help with high blood pressure, to aid in getting off prescription drugs. Again, that goes back to, I think, the whole blood sugar issue and blood pressure. Eucalyptol has been known as a terpene to help with blood pressure. Amy, do you want to comment on that? We lost Amy there for a second. But I think that like I say, if you go through those charts, you'll see that beta-caryophyllene and also eucalyptol are great for blood pressure and for diabetes. And I hope that will it get you off of prescription drugs? It really depends on, again, your body and what's going on. If you have a major problem with high blood pressure, it may be addressing it directly. And also you may need to address the anxiety or the reason that high blood pressure is being brought on, which could be physical, and it could be mental as well, and mental meaning from anxiety and that type of thing. So really, terps can help you. The two are beta-caryophyllene and eucalyptol, but also I would take a look at the whole environment, because that can also help just as well. Will said, I've heard that people put RSO on their flower and smoke it. Is that a bad idea? Manny, what's your thoughts?
Absolutely a bad idea. You don't ever want to inhale RSO, again, FSO, full spectrum oil, because it is whole plant, and because of the extraction process, the lipids, the chlorophyll and all that, it can really be harsh on your lungs and possibly hurt you. So I highly suggest do not use RSO on flower. What you possibly could do is use keef or a distillate on flower if you're looking to boost up the potency, but not RSO.
Right. I agree. RSO really should be kept as an oral type product, especially. I think that some of the RSOs are coming out now as sublinguals, which are really great. Tamesh asked a great question. Do you have any feedback on cannabis for recovery and performance, looking at how they help inflammation and building lean muscle? The people who manage the Olympic Committee have actually 6 years ago came out with a statement that they allow cannabis to be used, more importantly, CBD products to be used in the Olympic Village during the performances. In fact, almost every country now uses CBD with their athletes except for one, and that's the United States. So it has a true CBD, more importantly, full spectrum CBD has been shown to be very effective for recovery and for performance. And it's something that's helped a lot of athletes. There's a number of athletes out there, track athletes, for example, that have actually talked about it. If you take a look at the NBA, NBA is not testing at all for cannabis. Participate in a conference every year on athletes and performance, and we talk a lot about CBD. We talk a lot about cannabis, and really how things have really changed in the world of professional athletics with respect to tolerating cannabis, especially the CBD products. Amy, you want to comment on that?
Yeah, absolutely. So, I mean, the biggest thing is just focusing on terpenes that are going to help with inflammation, especially. And then focusing on CBD, having that ability to get a high dose of CBD without any, the headiness associated with THC can be really beneficial for recovery.
Right. I know I'm big in the golf world, and a number of athletes in the golf world have actually recommended products. And again, they're a lot of, like I said, a lot of sports are now looking at their position on cannabis itself. I know that especially the ISO, International Organization, has really bucked a lot of the, let's just say, the laws and regulations with respect to cannabis because of what it's doing to help the athletes. It is not performance enhancing. It is helping athletes be able to manage their inflammation and their pain. It really helps quite a bit. So I hope that helps answer that particular question. Angela, great comment. You want to comment on that, Manny?
I'm just reading it now. Midnight Special is the flower that has the most pain, but I haven't had it on. Okay, so Midnight Special is actually back in the vape right now, in case you're curious, in Pensacola. And THCA powder is also really great for boosting effects and helping with harshness. So yeah, thank you, Angelina. Greatly appreciate the appreciation. And the balm is back in stock. It's the Fix balm 1-to-1. And hopefully we'll get that Midnight Special back. As everybody knows, 420 just happened, so a lot of dispensaries are hurting on flower right now. But we will be getting back up and having that premium flower as well as our Florida depth flower back in stock soon. Thank you.
I think it's important to point out, and I'm going to defend a lot of the Surterra and a lot of the dispensaries. You're dealing with a botanical product that's being grown. I know you do a great job of trying to make sure that you're covering 12 months of the year the products that are there. But sometimes it just comes that there'll be peaks and valleys, both because of the production, the flower, the product is being grown at that particular time, and then also, candidly, demand. There are times when some flower, the product comes out and it just flies off the shelves. So I think both of them really help quite a bit. You mentioned THCA powder. You want to talk about that for a second?
Sure. So THCA is the acidic form of THC, which has no psychoactive or euphoric effects. And you could get the benefits of THC by using THC powder, mixing it with any beverage or sprinkling it onto ice cream or such. Most will probably use it to add to their flower or other product to give it a little boost of THC, because once you ignite it, as we discussed earlier, that temperature change is actually activating it, decarboxylizing it, creating delta-9, or if you ingested 11-hydroxy.
Sure.
So it's a nice little add-on to your products if you're looking for a little boost or for non-euphoric effects, mixing it for ingestion.
Right. Next week, we have a webinar on cannabinoids, and we'll be talking about THCA. Very interesting product itself. We had a question about stepping away and missed the answer to diabetes. Beta-caryophyllene is the primary terpene that you really want to look at, although humulene and also eucalyptol are very good for diabetes. And make sure, again, that the product you're looking at has at least one or two of those in there. Beta-caryophyllene is fairly well represented in a number of products. Do you want to comment on that, Manny? You have quite a few products with beta-caryophyllene in it, don't you?
Yeah, so it's again one of my favorites. It's the only known terpene as thus far that reacts with our receptors directly rather than kind of guiding THC or CBD. It's great for inflammation, stress, anxiety. It's an analgesic, great for pain, great on the gut if you have gut issues. So it's really also good for Crohn's as well as the diabetes as well. So and most of the guides, at least in most dispensaries, will suggest that caryophyllene is one of the better ones to go. Again, which you can find mostly in hybrids.
Right, right. They want to elaborate more on CBD usage during break periods. I know at least myself, when I take a break period, I break from everything, CBD, any CBD or cannabis-based products. I just let my body go cold turkey. I think that's the best way to go. Amy, what's your thoughts on using CBD during your break period?
Sure. So the way that some people do it is as they lower their dose of THC, they may actually increase their dose of CBD. However, it's not really giving your body the rest, and more specifically your endocannabinoid system, a rest from having outside cannabinoids introduced to it. So what you said, Mark, is probably the best way to do it is having just kind of cold turkey for a short period of time so that you're actually resetting your endocannabinoid system.
Sure, sure. That's there. Dean asked a question, what is rosin and resin? I think, Manny, that falls right in your category, isn't it?
Yep, I love to take those. So it's mainly based on the extraction technique. So resin is made using a solvent-based extraction, whether it's ethanol, CO2, or otherwise. And rosin is made using just heat and pressure. So I would, again, it depends on one's preference and how one's body reacts. I don't find a significant difference in potency, but I do find a significant difference in flavor or efficacy. What I mean by that, typically solvent-based extractions are usually going to be slightly more potent rather than a solvent-less, just using pressure and heat.
Sure, it's there. I'm a huge rosin and resin fan. I just think not only does the taste really come out, but I love the fact that it really protects a lot of the terpenes that are really there. One of the questions that came up is, can you get some feedback about cell regrowth in the space of wound healing? CBD has been known, I know in the last conference that I was in, the medical conference I was in, there was a whole section on using CBD to help with injuries. And I specifically injuries in athletics was the primary topic, but it does really help quite a bit. I know that CBD does more than address the CB1 and CB2 receptors in the body. There's about 5 different receptors that that CBD is known right now to affect. And one of them, by the way, is to help with blood pressure. And so what's interesting is I would say that there's a lot of research that's being done right now in this particular area. I would stick to a high CBD ratioed product for getting over a wound and a healing. And I know, again, that's being backed up by some research that's being done right now. Again, a lot of the research being done has not necessarily been published, but it is being, let's just say, brought out into the public, especially from the Olympic committees. And also, I should tell you, a lot of the sports teams, whether that's baseball, football, NBA or whatever, are doing a lot of work in this particular area. In fact, the NBA now has a whole, the NFL now has a whole study being done for on cannabis, not just for the mental part of the game, which has been affected, but also on just being able to help the whole body in general. So I would say look at his high CBD product and pay attention to a lot of the research that's been coming out right now. Please state the terpenes for DM. DM. Can you help me with DM? What that means?
Not sure on that one.
Diabetes mellitus.
Okay. I think we answered the diabetes question just a minute ago, hopefully. And so hopefully, again, play attention to beta caryophyllene. Angela says, I feel cranky and run down during any break period. That will, again, when you take your break period, what's happening is cannabis isn't in your body. A lot of the conditions that you're trying to address will start to show themselves. I know myself, for example, pain comes back. It's something that is shows you that cannabis is working, but it does really help you if you take that break period to rejuvenate your body. Amy, you want to comment on that? Because I think rejuvenating your body, I think, is really important during the break period.
It is really important, and it's just giving your body that time to recuperate and rest. And that's where, either going cold turkey to have that break, or if you're trying to do something like wound healing, increasing your CBD dose, all of those things can help.
Right. Angela asked an excellent question. Will you have access to the cannabinoids webinar next week? The answer is absolutely. Go to Marijuana Aware and feel free to RSVP and register for the webinar, and you'll be able to, again, like tonight's webinar, be able to see a presentation on the cannabinoids as well as the slides and being able to ask questions. And I hope that helps quite a bit. Claire, I think if we're talking too fast, I really apologize on the diabetes issue. You really want to pay attention to beta caryophyllene. That's the primary terpene you want to take a look at. Claire asked a question about CBD for cancer patients. Manny, do you want to take this one or you want me to take it?
Yeah, it'd probably be better if you did.
Okay, we have a webinar we're going to be doing at the end of June on specifically on cancer and cannabinoids. Excuse me, cancer and cannabis, of which we do touch on cannabinoids itself. This is a really interesting subject because there has not been a lot of research done in the United States because it's a Schedule I drug. However, 26 years ago, and let me say that one more time, 26 years ago, the country of Spain created a lab in Spain for Dr. Cristina Sanchez, who has been studying cancer and cannabis for 26 years and has over 1,200 studies on this. Now, a lot of her work was done with for breast cancer initially, although she now has branched out and worked with people around the world to be able to work on different cannabis and cancer treatments. CBD will assist cancer patients. However, you do need a certain amount of THC in there. And I think that when you're taking a look at things like CBG and CBN, I think it really helps quite a bit. Amy, do you have any comments on that, or do you want me to comment further?
Yeah, I can cover CBD, CBG, CBN. So those are going to be minor cannabinoids. Specifically, CBG is really great for focus and mood elevation. CBN is going to be hard-hitting, very sedative. So it can help put you to sleep if that's something that you have problems with.
Yeah, I think it's something that really to pay attention to, that's really there. One of the questions that comes up is, does CBD assist with healing of shingles? I've not seen a study on that. Have you seen anything on that, Amy?
I don't know that I've seen specifically shingles. Most of the research that I've seen is related to like trigeminal neuralgia, which is not the same at all. So
right. Manny, you have any comments on that?
No, I haven't seen anything specific on shingles. However, we do say that CBD, as we all stated, helps with the inflammation and some of the pain, but you'd have to build up to that. And it wouldn't necessarily heal it, but it may alleviate it.
Right. Yeah. I think again, I try to stick to as much information that's been reported, and I haven't seen a lot of studies on this, although I will pay attention to it and see if something comes up, Claire. Donna asked a great question. How long and often should you take a break? Amy, your comments on that?
I think it totally depends on how you feel using your medications. If you feel that you are increasing your dose just exponentially, it's time to take a break. How long that break is depends on how long you can comfortably stop using the medication for. So that might be a day, it might be 2 days, just like you said, Mark. You get to about the day mark, and then your neck starts telling you that you need to start taking medication again.
Right. I have found myself about every 4 to 6 weeks. I try to religiously do it at least every 6 weeks, and sometimes after 4 weeks, I kind of remind myself. I don't think it's good to go more than 9 weeks without taking a break. I think Again, I would keep it in the 4 to 6 week category. You will notice a difference. I noticed again, when I took a lot of my classes on cannabis, they were talking about taking 4 days and 5 days off. Although I have to tell you, I can't do that. I mean, after a day and a half, I really have to get back on it, or I will be a painful animal that's not nice to be around. So I would say 4 to 6 weeks is my thoughts, and I hope that really helps.
If I may, Mark, on that point, one of the things that I found with some of our patients or customers that come in is they are not able to take that break because of how much pain or whatever they're suffering from. One of the things we suggest is mitigating with CBD throughout the day. So we find that most people don't use THC all day. It's usually right after work or after they're doing something important. So in the meantime, why not take CBD, which is non-euphoric, non-psychoactive, to help mitigate the tolerance in between and effectively working your biphasic effect.
Right. I am not familiar with this particular condition. Amy, are you familiar with this condition? Trigeminal neuralgia?
Sure. So trigeminal neuralgia, it is a nerve condition and it causes nerve pain. From the research that I've done, alpha bisabolol, I apologize, I probably totally mispronounced that, can help with nerve pain, which is a side effect of trigeminal neuralgia. And that's also what's causing pain when somebody has shingles. It's a nerve pain. So alpha bisabolol.
Right, right. I know that yeah, it's something that really helps. You mind sharing your go-to products? I'll be very specific. I use a Surterra product, and the product I use is a 4-to-1 ratio, 4 THC to CH1 CBD. You want to comment on that, Manny?
So the 4-to-1, I believe, would be the Zen product.
Yes. Exactly.
And one of the beautiful benefits of Zen is that it's typically a sativa cultivar or category product, which means it's typically used for the daytime, but it doesn't have a lot of that alpha pinene mixed with limonene. It does have a lot of limonene, which is great for stress, pain, anxiety, and so forth, but it doesn't have that alpha pinene that will give you that raciness, or kind of like if you took an energy drink and tried to sit down. And it does come in a vape. It comes in a tincture and TheraGels as well. So you have multiple routes of administration to take it. And typically we would suggest a vape for the breakthrough. And then within the hour, you take your tincture or TheraGel or something comparable. So that way you're not on a roller coaster. You're more on a smoother pattern, if you will, rather than bouncing up and down between vaping.
Sure. And I should mention, when I start the day, when I wake up in the morning, I can wake up. Some days I may wake up with pain that's a level of 7 or an 8. I mean, I have inoperable condition in my neck, and there's not much I can do with it. I use a vape pen. The first thing I do when I wake up is I grab a vape pen and I take 1 or 2 hits from it, and it really takes that pain level down to like a 1. And when that happens, it's just amazing. It's like somebody wiped my back and the pain goes away. And then I use the Zen. And I start with that. Middle of the day, I will use 1-to-1 and use a product that's for that. And then at the end of the day, I'll go back to using a Zen. And then there are times that you have, what I like about Surterra products is you have 2 products that are really effective that I found. One's called Relief, which is great for addressing pain, but the other one is one called Dream, which is, both of them are 1-to-9 ratios. Manny, you want to comment on that?
Yeah, absolutely. So the Relief, as you just suggested, is going to be great for pain and relaxation and or sleep, whereas the Dream is going to be mainly for relaxation and sleep. It may not help as much with the pain. So though the ratios are the same, the terpenes are going to be different. Relief has more of the B-caryophyllene, whereas Dream is more going to be myrcene and linalool and other terpenes rather than that B-caryophyllene. So it's a lighter, if you will, relaxation than the Relief might be, as it's helping your pain as well.
Right. I think we've answered most of the live questions. There's one I saw from Lisa about, will CBD help heal cancer, help it go away, as well as the symptoms? First of all, cancer is a very serious condition. there's not a cancer. There are cancers. There are over 100 different types of cancer conditions that can affect your body. There's obviously the top 10 that the doctors try to address. So then there hasn't been a whole lot of research, candidly, by the pharma companies, much less the cannabis companies, on the efficacy of addressing cancer. Now, I can tell you that from history, there's a lot of healing that's been done, especially in the Asian world, and a lot of it has to do with CBD products. But in each case, you have to have some THC to be able to address cancer. That's one of the things that Dr. Cristina Sanchez has shown, is that the combination of CBD and THC is critical to address cancer that's out there. And I know you go to the social media and you go to a lot of different areas and said, I took the CBD product and my cancer went away. Don't bet your life on it. That's the best way of putting it. Go to a medical cannabis practitioner or professional, talk to them about it. In fact, I think that if you're going to address cancer, the best product that I would recommend from a cannabis standpoint is RSO. Amy, you want to comment on that, or Manny, you want to comment on that? Because I think RSO really is a better product than CBD.
You want to go first, Amy?
Yeah, sure. So I would totally agree with you, Mark. I think RSO is the way to go. And that's just because it truly is a whole plant product. And so you're getting all of the benefits. So it's not just CBD, it's not just THC, it's the entire plant.
Yeah. Manny, you want to comment on that?
There's not much more else I can say. I agree with the both of you.
Yeah, I think it's important. I really get bothered by these ads that I see that says I took cancer and I took CBD and it got rid of my cancer. That's not the case. I can tell you, I've studied a lot in getting ready for this. We've been doing the cancer seminar for a couple of years. In fact, Dr. Newton and I are going to be doing it in public at the beginning of June. We're having a conference here in Orlando. But it's really going to be important that we address the fact that you have some THC in that particular product. And again, I'd go with RSO. I'm passionate about addressing cancer, and I'd like to see a lot more research being done, especially here in the United States, on that subject. One great question is about how relief has helped with pain. You haven't heard that? You've never heard that before, right, Manny?
Not at all. But Anonymous is actually getting specific with the drops, and I like to address that. So we have multiple or variable routes of administration and relief, and we typically have relief in drops, which is different than the tincture. The tincture is MCT based, which is a multi-chain triglyceride oil, something like coconut oil, palm oil.
Right.
The drops are not. So the drops are going to be water soluble, so you can mix it with an iced tea or a coffee or something. Whereas the tincture, since it's oil based, is going to separate. And we recommend using tinctures if you don't want to take it directly under the tongue sublingually, which is suggested, to mix it with something fatty because it's already mixed with something fatty. So smoothie, yogurt, something else that's going to be able to mix well. Whereas the drops are going to be a little bit more convenient, where you can just drop it into anything, a couple of drops, and have the effects once you finish your drink.
Right. So I think one last question that really came in was omacine. Omacine is really great for, it's actually used a lot in perfumes and cosmetics, by the way. So I'd say I put it more in a topical category. It's high on limonene and high on humulene, so it's something to pay attention to. But it does have a very low boiling point, and so you have to be very, very careful with it. It is effective, but it's something that you really have to pay attention to. Best terps for increasing appetite. Manny, you want to try that one?
Yeah, it all depends on an individual's particular bioavailability. For the most part, as based on customer feedback, we're finding that more of the hybrid to indica hybrid products actually increases the appetite. And some studies would suggest that because you are more relaxed and ready to just chill out, your blood is more with your dominant organs, especially the gut, therefore increasing appetite. However, it is dependent upon every other person. There's not particularly any terp that I've found so far that actually increases the appetite or suggests otherwise.
Right. I think the overall effect is it really helps with appetite, but there's not a specific one. I think it's a combination of the myrcines and the limonene and those types of things really help.
Yes, sir.
Well, listen, we have taken on a lot of questions. We've gone a long time tonight. First of all, I want to thank everyone for attending the webinar tonight. I know that this is, we've gone on a long time, and I think it's really important to get your questions answered. And hopefully, again, my goal is if I can just help one person get their life back, then this has been worth the webinar that's there. I think that terpenes are really critical, and thank you very much for joining us. Amy, do you have any final questions or any final comments you want to make?
No, I think just remember that cannabis is an individual journey. What works for one person is not guaranteed to work for another. It's super important to keep a journal and just keep trying until you find that thing that works for you.
Right. I think it's what's interesting in that when you find it start relieving, when you get that relief, you'll know right away. The key to cannabis is listen to your body. Michael, I do want to, you asked a question about in a follow-up email, will you get a link to the video and the presentation? And the answer is absolutely. That'll be in the follow-up email that you'll get from this particular presentation. Forrest and Manny, thank you very much for hosting and sponsoring this webinar. Do you have any final comments?
I would just like to say, if anybody's out there who still has questions that we didn't answer this evening, please feel free to come by the dispensary. Even if you're just looking to find out how to get started, we're more than happy to assist you. We'll sit down with you. And if one of us doesn't know the answer, I'm sure we'll find somebody within the dispensary that can help you out. And thanks for having us here, Marc.
Right. And Forrest, any comments on your side?
No, this has been excellent. We appreciate all the feedback. I'm loving the comments that are coming in, and some of this stuff we will absolutely take it for some of our product development conversations. So really appreciate having us here tonight.
Yeah, it's very important, I think, that to have a forum for folks to be able to ask questions and get questions answered. So that being the case, next week, we're going to be talking about cannabinoids, CBD, THC, CBN, Delta 8, plus more. Please join us next week, May 10th at 6 p.m. And again, you asked where, I think we were asked earlier, how do I attend that? Give us an RSVP at Marijuana Aware, and we're there. And last, I want to give a shout out to Alyssa Katera, who came up with the idea of this webinar series. She's really was the spark plug that made this happen. I want to thank everybody for joining us, and hopefully we'll see you next week. Thank you very much.